The drug we decided to talk about is Krokodil. We decided to discuss Krokodil because we wanted to do a drug that wasn't as prominent in the United States. This drug is named after the crocodile because it is said to make your skin feel scaly. Krokodil is referred to as a heroin substitute because it is cheaper to create. It is referred to the drug for the poor. It is a popular drug in Russia and is referred to as Sharonaya, and in the Ukraine it is known as Hamaya. It can be made in codeine-based headache pills, and about 5% of Russians are users of Krokodil. According to doctors, Krokodil's main substance, desomorphine, causes the strongest level of addiction and is the hardest to cure.
So crocodile goes by the scientific term desomorphine, and desomorphine is an opioid derivative of codeine. And the original intention for desomorphine were the calming effects of anxiety and fear. The appeal of Krokodil among the general public is that it is convenient due to its easy to access ingredients like gasoline, lighter fluid, paint thinner, and cleaning oils. It is very prevalent in Eastern Europe and Russia. It is known as the zombie drug and the world's deadliest drug due to its mortality rate. It is 8 to 10 times more powerful than morphine and is known as Krokodil because patients that use it get crocodile scales on their skin.
So the history of Krokodil starts out originally as a patented drug that was patented November 13th, 1934. This was US patent 1980-972, and it was patented by Lyndon Frederick Small, who was a US physician studying different types of painkillers during the 1930s. It was named as a morphine derivative and process, also known as desomorphine. It's manufactured and marketed by Roche under the name Permoid in 1940. It was sold as a post-operative analgesic in Switzerland and was withdrawn from the market in 1952, and this was due to its highly addictive nature. This drug was also never sold in the United States because governing parties were worried that this would cause extreme addictive habits within people that used it in the United States. The production was not stopped until 1981, and this was due to one specific patient that was still using the drug for an unspecified disease, but production was halted after their death in 1981. The reappearance began in Russia in 2003 when people began making the drug from common items that they could buy in local stores. It was not until 2012 when the name Krokodil was given to the drug. This was used as a cheaper heroin substitute due to the fact that it was only 1/10 of the cost. In 2013, widespread use was found across Europe, and this was due to migration from Russia and Ukraine into other European countries.
The main component in Krokodil that is responsible for its psychoactive effects is the compound desomorphine. Desomorphine, being an opioid, results in pain relief, respiratory depression, euphoria, and sedation. As seen here, desomorphine is highly similar to both codeine and morphine. However, this structural difference allows for an increase in activity in desomorphine compared to codeine and morphine. In fact, this effect is believed to be 8 to 10 times greater than that of heroin or morphine. Besides the enhanced effects from desomorphine, Krokodil is also quite popular because of the cheapness and ease of production. This process of creating Krokodil requires very few tools, and all the ingredients can be commonly found in supermarkets and drugstores. Furthermore, once the materials are obtained, the desomorphine can be created from codeine in 2 easy steps. First, codeine is extracted from codeine tablets using a strong base solution. This results in people on the street using whatever they can easily obtain, such as gasoline or paint thinner. Once the codeine is isolated, it can then be reduced to desomorphine with the help of iodine, water, and red phosphorus. Iodine can be found in many medical solutions and red phosphorus from matchboxes. As a result, it can now be seen why this drug has become popular, not only because of its strong opioid effects, but also the ease in producing this mixture. Although many studies have been done on desomorphine, very few studies have been done to understand the other components in the crocodile mixture and the effects they can have on the body. Now, when it comes to the consumption of crocodile, the mixture can be consumed within 45 minutes of being created. Similar to other opioids, crocodile can be ingested multiple ways, but most commonly it is injected intravenously. Reports often state that users inject into places like the armpits or femoral regions to help prevent others from noticing. This is to help hide the side effects and shield the user from the stigma surrounding its use. These injections result in quick euphoria feelings in a matter of 2 to 3 minutes. Not only do the effects begin quickly, the effects only last for less than 2 hours, resulting in frequent reuse to prevent withdrawal symptoms. As a result, the combination between availability and quickness of use lead to continual consumption of crocodile for users.
There are many side effects that crocodile use can cause. The first being vein damage, which frequently overlaps with heroin use due to the utilization of needles as a common form of ingestion. This also leads to soft tissue infections because often needles that are used by crocodile users are unsafe or unclean. Additionally, there are more severe side effects that can be caused, such as necrosis or gangrene, and these are usually affiliated with the infections that are caused due to the synthetic nature of the drug. There are also very serious illnesses that can come as a result of the use of crocodile, including pneumonia, meningitis, and sepsis, which is a blood infection that can often lead to death. The prevalence of crocodile is predominantly found in Russia. There's been no tangible evidence of use of crocodile in the United States since 2004. As we alluded to earlier, there is a high percentage of people that use this drug in Russia, and it is referred to as the poor man's heroin. It's important to make the distinction that the lower standard of living in Russia makes the affordability of crocodile very important, because crocodile is even cheaper than heroin is on the market, which we as Americans view as a cheap drug in the first place.
In conclusion, we've decided that crocodile is a deadly drug that affects about 5% of Russia's population. It originated as a patented drug, which means it's kind of scary to think about its deadly effects. This is like Sean just said, it's known as a cheap version of heroin. And as Hunter said, there's various ways to inject it. This drug is somehow, in recent reports, is emerging in the United States, but very slowly. Crocodile has a very distinctive smell of iodine that cannot be removed unless burned. Its main substance of desomorphine causes it to be very addictive and hard to cure. Thank you for listening, and stay away from the crocodile.